Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former health commissioner here in Baltimore. Our goal is to bring evidence and experience to illuminate critical public health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith Rogers, producer of Public Health on Call. Today, our topic is alcohol in New Mexico. Dr. Josh Sharfstein speaks to Ted Alcorn, a journalist raised in the state, about a series of articles he has published with New Mexico In Depth, a nonprofit investigative news website. Let's listen.
Ted Alcorn, thank you very much for joining me in Public Health on Call to talk about this series of articles you've written about alcohol in New Mexico. The title is Blind Drunk. Why Blind Drunk as the title, and what did you find?
So my home state is New Mexico, and I grew up there with an awareness that the state has had a long struggle with addiction. It's one of the poorest states in the country. It's got a lot of other kinds of inequalities and disparities. But even for me, looking at the data related to alcohol-related mortality in New Mexico was really eye-opening. The state has the very highest rate of alcohol-related deaths in the country, head and shoulders above every other state. And it's a problem that's much vaster than I'd realized. Alcohol killed more people in New Mexico in 2020 of working age than COVID did. And yet there's really very little awareness of this in the state. And I would say both among the population, among its elected officials, and among organizations that are looking out for the well-being of the state. They've really turned a blind eye to the problem. So the series, ultimately, which started with this question, why is New Mexico's rate of alcohol-related deaths so high, spun into a series of articles trying to unpack some of the factors that contribute and figure out what the state should do about it.
So when you talk about alcohol-related deaths, we all think about drunk driving, for example. I imagine that's part of the overall story. What are the other big components to the ways that alcohol kills people in New Mexico?
I think that we tend to emphasize the types of harm that are most catastrophic and most in the public eye. And exactly as you said, intoxicated driving and crashes on public roadways have attracted a lot of attention nationwide and in New Mexico. And in fact, it's kind of the bright spot in New Mexico's response to this problem, because in the 1990s, the state really mustered a whole of society approach to address DWI and cut its rates by 70%. But a focus on DWI really is kind of missing the forest for the trees, because alcohol's harms are much more likely to occur in the form of chronic illness, in terms of violence. So in New Mexico, more people die with alcohol in their blood due to a homicide or suicide than they do on the roadways. And vastly more people die of alcohol-related disease in the hospitals and ICUs of the state, of alcohol-related liver disease, of cirrhosis. And those numbers have been climbing rapidly, and they're really what's driving most of the growth in the state. And more than half of alcohol-related deaths in the state, nearly 1,000 last year, were just those chronic illnesses related to heavy drinking.
Were there particular groups that you found to be most likely to die from alcohol?
Generally, men drink more, seem more exposed to the harms, and have higher death rates. But it's often younger people than one might typically think, the 35 to 55-year-old range. And although the absolute risk might be highest for men of that age group, some of the fastest growth in alcohol-related deaths has been among women, because women who drink a similar amount to men are exposed to much more profound harms physiologically by that. And then in New Mexico, there's huge racial disparities, which are extremely concerning. The native population in New Mexico has about 4 times the rate of alcohol-related deaths of the rest of the state. But some of those disparities have also contributed to sort of misunderstandings about the problem. When I talk to New Mexicans, even friends, clinicians, a lot of them think that the native population might sort of explain the state's elevated rate and sort of to explain it away. when in fact, Native people have never accounted for more than 20% of alcohol-related deaths in the state. Even without Native people in the state would still have the highest rates of alcohol-related deaths in the country. And then some of the stereotypes around Native people and drinking that are widely repeated and commonly held, like the belief that there's a genetic predisposition to alcoholism or to the harms of alcohol, are just flat out wrong. And I think just looking at the science and understanding the true sort of structural nature of some of these racial disparities is another aspect of the story that I reported.
So are you saying that there's no genetic basis for alcoholism?
No, there's definitely clear science that heredity explains about 50% of a person's predilection to addiction for alcohol. And I think what researchers were emphasizing to me is there's this mythology that Native people and the disparities that they experience in terms of alcohol-related deaths are entirely attributable to genetics. And there's a lot of study into this. There's really not much strong evidence showing that as a group, Native peoples are at any way higher risk of developing an alcohol use disorder or developing harm from it. And I think maybe most important of all, that those could in no way explain the enormous disparities that we're seeing in terms of harmful outcomes. And so I think instead of focusing on genetic factors, which in some ways deprive Native people of a sense of agency that they can change their future, they can change their relationship with alcohol, the researchers really call on us to look at the disparities in the environment, in the history, and the treatment and the unequal treatment of Native people as some of the strongest factors explaining these big differences in illness.
Got it. Now, given the incredible burden of what you're talking about, how has the medical community responded?
You know, it's really interesting. Alcohol use disorder turns out to be the largest untreated substance use disorder in New Mexico. There are more people with an alcohol use disorder that's not treated than all other substance use disorders in the state combined. And I spent some time talking with clinicians in some of the best facilities, some of the addiction specialists in the state who are, I think, the most knowledgeable and most compassionate. And there's excellent care available. The challenge is that clinicians often think that alcohol use disorders are something that they need to refer patients to a specialist for, or to intensive inpatient or intensive outpatient services, and therefore sort of shirk what I would say is a responsibility to address alcohol, excess drinking, and even alcohol use disorders in the primary care setting. And so the addiction specialist I spoke with talked about this being one of the biggest missed opportunities, is just to move beyond asking people how much they drink to counseling, to actually counseling people in a doctor's office about reducing their drinking, not necessarily eliminating drinking, but even a slight reduction can have big health benefits for the individual. And then some of the medications that have been shown to help people control their cravings, naltrexone is the one that I was focused on specifically, are just really underutilized nationwide and in the state. Only a tiny fraction of people who could benefit from them to help control their alcohol use are receiving them. And so that's another area where the medical establishment could do a lot more. And I spoke with some of the medical associations in New Mexico, which exist, I'm sure, in all localities. And although they're very aware of alcohol being one of the primary issues that they should be addressing, they've done remarkably little in terms of training clinicians, creating materials to introduce this into continuing educational materials. And when grants that were specific to helping raise the profile of alcohol among their membership ran out, that the efforts ran out. So that's an area where I think there's need for a lot more investment by the medical community.
So what you're describing is a major public health challenge hiding, in a sense, in plain sight. You've got all kinds of violence linked to alcohol, car crashes, as you mentioned, chronic illness like liver disease, and the medical community not really mobilized to address it. What about policymakers? Have they recognized this problem and started to take actions to address it? Or is it a different story?
I think fundamentally, this really is a story of a problem that has to do with governance. Because in the end, the scientists that I spoke with say the evidence about how we can address alcohol use is pretty clear. There's been decades of effort to understand how the drinking environment influences alcohol use. And I've kind of put it out front and center when I'm talking about this. I drink alcohol. Most of the people that I spoke with drink alcohol. None of them said that it was realistic or even reasonable to restrict alcohol to the point that we have in the past experimented with as a country. What we're really talking about is having regulations that better control where and how alcohol is sold. And the history of policies influencing the drinking environment in New Mexico are much the same as they are around the country, which is lawmakers have just totally turned their back on these kinds of tools. The most important and most consistently studied is the price of alcohol, which basic economics teaches you the price of a good influences how much people consume of it. And the research shows alcohol in the terms of real terms has never been cheaper. Prices of alcohol have fallen over time, sometimes for beer 80%, for liquor over 90%. And so to drink heavily nowadays does not take the same amount of income that it did even 30, 40 years ago. And a big part of that is because alcohol taxes have been allowed to almost disappear. Last year, federal lawmakers cut the federal excise taxes. New Mexico's lawmakers have allowed them to dwindle. It's unfortunate that this doesn't seem to be something that's divided on partisan lines. Governors of both parties in New Mexico, at least, have overseen this. And the public health officials that I spoke with former state epidemiologists, former alcohol epidemiologists in the state going back decades. And they said consistently that governors ignored the evidence that they brought to them. When they suggested talking with lawmakers about this issue, they were not given the go-ahead. When they wrote up evidence about what the state could do to address alcohol use, they said they had to mince their words. So I think that there's really strong political pressure to not pursue this as a public health problem. And unfortunately, it's gotten worse and worse to the point where it really can't be ignored.
Now, you did mention that New Mexico has taken some actions in the past on intoxicated driving. Is that a potential model for the state to follow in terms of the kind of response that then could be extended to other areas of the alcohol issue?
I think it is. And New Mexico is not a place that typically is at the top of national rankings. We don't usually think of it as a place where vanguard things are occurring. But because it has struggled with some big public health issues, it really has been forced in the past to innovate. And the opioid crisis is one. New Mexico was hit early by heroin overdose rates that were much higher than the rest of the country, and did some of the sort of vanguard work in creating policies to make harm reduction services available around the state. And DWI, I think, arguably is also an area where the state has been really innovative. And in the 1990s, galvanized by tragic crashes that really brought the public's attention to this, and leaders who said we were really going to tackle this in a systemic and sustained way. The state's lawmakers reacted by changing laws, by increasing training for servers, by motivating the courts and police to address it in a more holistic way. And it really took a whole of society approach. And the results, I think, can't be pinned to any single one of those steps. But advocates and the people who led those efforts say there was a cultural shift. And ultimately, the complex behaviors that result in intoxicated driving changed, and norms changed about what was acceptable. And it worked to a point. I think we're at a point now where New Mexico is facing sort of a similarly complicated, intractable problem that has to do with a lot of different behaviors related to alcohol. And it's going to take a similar cultural shift, one that starts to recognize that alcohol is the most popular drug, I guess I would say, in our society. It's woven into weddings. It's woven into communions. It's woven into some of the happiest moments of our lives. But it has this huge and profound social cost. And
you've talked about taxes as one possibility. You've also said that you don't think prohibition is a good idea. So what else is on the list of things that New Mexico could do?
So the public health folks, of course, want us to invest in some of the basic building blocks of tackling this epidemic better. They want to measure it better. So there's just the way that we track prescription drugs through prescription drug monitoring programs. Some of the former state epidemiologists said the state should better use tax and revenue data to understand who's selling alcohol and what communities, what volumes. We have really little data on that. The state also has one single alcohol epidemiologist in the public health department, a place that is, like many of the people on your podcast, been burdened with a ton of responsibilities, particularly in the last 2 years, and with a stagnating budget. And so, they want more investment in the basic public health expertise to tackle this issue. Certainly, DWI is, like I've said, something we want to look beyond, but some of the measures that have been related to DWI, like lowering the blood alcohol level that's allowed, the threshold, that's an area for a lot of improvement. Utah is the first state in the country to reduce its blood alcohol threshold to 0.05, and it cut crashes there 20% in the last couple of years. So there's an opportunity for New Mexico and other states to do that. There's a lot of focus on the density or the number of businesses that sell alcohol. When they're highly concentrated, there's pretty good research to show that in their proximity, they foster violence and crime. In New Mexico's communities, a lot of them have had far greater numbers of outlets that sell alcohol than are allowed by law. So that's an issue as well for the state to tackle. So, there's abundant opportunities, and we include a whole sort of laundry list of them, both for the legislature and the governor to look at. But it's going to take civil society as well to get engaged with this issue. And for me, what's been remarkable is to look around at some of the other public health issues of this scale and to see patrons, to see progressive organizations that are working on them. If you look in New Mexico or nationwide, you will really not find anyone who is focused on addressing the harms of alcohol explicitly. The biggest organization that I could find nationwide, the Alcohol Policy Alliance, has a budget of less than $50,000 and one staff member. It's, these are voluntary organizations, and when you see them up against billion-dollar alcohol interests, they can't stand a chance.
So it's potentially a long road, but that road can start with clear descriptions of the problem. And your series, which we will link to in the show notes, is really a great example of effective public health journalism. Thank you for doing it, and thanks so much for joining me today.
Thanks for having me.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinell, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Holes Fernandez and Amber Bryan Singletary. Thank you for listening.